Hi, my name is Dr. Mark Pimentel, and I'm from Cedars-Sinai Medical Center in Los Angeles. We have a new theory that's developing that suggests that acute gastroenteritis or food poisoning may actually cause irritable bowel syndrome. So how does that work?
Over the last 30 years, medical science has had a difficult time accurately defining, characterizing, and ultimately diagnosing IBS. In the 60s, IBS was referred to as spastic colon. In the 80s, medical professionals began to characterize it as irritable bowel syndrome, and by the 90s, functional bowel disease of the IBS type. The most significant change over that time was the increasing amount of scientific evidence supporting the theory that IBS is a direct outcome of an infection precipitated by an episode of acute gastroenteritis. Multiple studies have confirmed for us that there were a common set of bacteria involved: C. jejuni, Salmonella, Shigella, and E. coli. Additionally, there was a common toxin to these bacteria, cytolethal distending toxin, otherwise known as CDTB. CDTB is a neurotoxin that impacts the small intestine. As with any toxin, the body reacts with an immune response. Antibodies are generated and sent out into the bloodstream to protect the body. Because of structural similarities, these antibodies cross-react to a protein commonly found in the nerves of the gut known as vinculin. This process of cross-reaction, which is called molecular mimicry, results in an autoimmune response. Attacking vinculin has another deleterious effect: neuronal degradation in the lining of the gut, which leads to reduced motility. The outcome of this cascade of events is stasis in the gut, which ultimately allows for bacterial overgrowth, also known as SIBO, or small intestine bacterial overgrowth. For the patient, this bacterial overgrowth manifests itself as the bloating and abdominal pain that are the initial symptoms of IBS.
I'm really excited about these new biomarkers for diagnosing diarrhea-predominant irritable bowel syndrome. Diagnosing diarrhea-predominant irritable bowel syndrome has been a challenge, especially in the setting of trying to figure out the cause of diarrhea and separating diarrhea IBS from inflammatory bowel disease or celiac disease. But even more exciting may be that in the future, as new studies are concluded, we will be able to say that we can diagnose all of IBS, including constipation-predominant IBS and mixed IBS.